on the calf specimen. And here you can see on this calf, we've removed the right limb. So you'll start with that step and just take off the right limb, similar to how the left limb was removed as well. And then you'll take off any remaining skin that's between your thorax and abdomen area here. You'll probably just have a strip about that wide or so, and you'll just remove that. So you can reflect that on both sides, and then you can remove the skin and discard it if you would like to. And then this dissection is being done on both left and right sides. So we're working on the thorax area here, and we'll take a look at those muscles. So here on the left side, you can see some of the muscles we've already talked about, specifically your Latissimus dorsi, which is here and hopefully still attached. So that will be reflected dorsally and still attached by that fascia, the aponeurosis there. And then we're looking at the serratus ventralis muscle. So you have two parts that we talked about previously. You have the cervicis portion of serratus ventralis here, and then you have the thoracis portion here on the thorax. So the thoracis portion of serratus ventralis is what we are focusing on for this dissection, because we need to remove it, reflect it forward to get at the ribs here. So what you want to do is start caudally on that muscle and just pull it up, and then with your scalpel you want to just remove it from the ribs. So you're going to work underneath the serratus ventralis and just pull it forward. So you're going cranially, so start caudally and reflect it cranially. And you're going to peel off those serrated edges there and then just work your way forward. So you're going to reflect it cranially all the way up until you can see the first rib. So make sure you can see that first rib and then keep it attached. You can keep it attached by the cervicis portion here, and that way it won't fall off. And after you do that, then you'll be able to see the serratus dorsalis muscles. So serratus dorsalis, cranialis here, and then you have serratus dorsalis caudalis portion here. And again, you want to work under the serrated edges, so we're starting distally and working our way under the edges and detaching them from those ribs. And you'll reflect it dorsally here. So you'll peel that away and reflect it dorsally, trying to keep it attached via this aponeurosis here. And so you're just kind of reflecting that up with that Latissimus dorsi that's already up there. And so you try and keep that attached. Then you have serratus dorsalis caudalis. And in the calf, it's a little bit smaller. There's less muscle parts than in the pony, so it won't be quite as extensive in the calf. In this one, I just kind of have 3 little slips of muscle here for the caudalis portion, but you want to work underneath those serrated edges, and again, just reflect it dorsally toward the midline of the back and just keep it attached. Then underneath, you can see your epaxial muscles. So again, I use that mnemonic like we did in the dog. It's the I love tacos. So I would be here, that would be the Iliocostalis system. Love would be L, so Longissimus system is here. And then tacos, the Transversospinalis system is here, which we've already dissected the splenius muscle. So that's part of that Transversospinalis system. So we want to focus on the Iliocostalis and the Longissimus system for this dissection. So the Iliocostalis is specifically the one we want to reflect, and if you need to, you can remove it entirely. But the Iliocostalis, you want to work under the distal edge here and kind of remove it from the ribs, and you're going to reflect the whole thing cranially. So you're going to reflect it off of the ribs and just take it cranially, and if possible, leave it attached right at that first rib. So then you can see the Longissimus system, and that has 2 parts. That has the thoracic part here, and then it has the cervical part here going to the neck. And what we're going to do is take a look at these intercostal spaces in between the ribs and those intercostal muscles. So we're going to be removing those to get at the ribs, and then we're actually going to remove ribs to expose the thorax for dissection. So we'll take a closer look and I'll show you how to do these intercostal muscles. So here we're looking at those intercostal spaces, and we're going to remove the intercostal muscles. So I'll just demo a couple of them and then you can finish them on your own. But here we want to avoid cutting into the last 2 intercostal spaces or so in the calf. Since we won't need to get back to that area for the dissection in the thorax, we're just going to start here. But you want to start caudally, and then you'll work your way cranially through those spaces. And what you want to do is just make an incision, just kind of a stab incision there. And then you work your way down. So on the cranial and caudal aspect of each rib, you're going to just cut away the muscles, the intercostal muscles, and then pull it down as just a strip. Then, as we do this, we will be looking for the line of pleural reflection, and that will be where you're running into where the pleura reflects onto the diaphragm. So let's get this started, and then I'll try and show you how to do that. So you're going to be sticking your finger in, and as you work your way down the rib, you'll feel for that reflection. And it will be where your finger stops. It won't go down any further. So as you go, you'll just keep feeling your way. And now I'm getting close to that line of pleural reflection, and then you want to stop there. So you'll connect with the other side, so go cranially. And you'll connect there, and then remove this whole strip of intercostal muscles here. So you want to have a bucket underneath your specimen for this part, especially once you get a little bit further down. It will have fluid that comes out of the chest cavity as you do this dissection. So then we'll do one more here, and then you can finish up by doing all of the rest of them. But again, cut dorsally and then along cranial and caudal aspect of each rib, and just remove that strip of muscle. And as you go, make sure you're feeling with your finger so that once you get close to that line of pleural reflection, you can stop. Since we don't want to enter the abdomen just yet. And here you can see some of that fluid coming out that I was talking about, so you want your bucket there to catch it. So I'm at that line of pleural reflection, so I just want to go cranially and then connect the 2 sides here. And then remove those muscles. So then you'll continue, and you'll do that for all of the rest of the intercostal spaces. So go all the way cranially to the first rib, and you'll do that on both the left and right sides. So here you can see that I've finished removing those intercostal muscles between all of the ribs. So at each space we've removed the intercostal muscles, except for those last couple. We can leave those in place. And here you can see the space created in between the wall of the thorax, so between the ribs and the diaphragm. So that's what you're seeing here is the diaphragm. And that is the Costodiaphragmatic recess. So that's just that space inside where the probe is there. And that's where the pleura is reflecting. So it's reflecting at the line of pleural reflection from the wall to the diaphragm. And that space in between the 2 sides is the Costodiaphragmatic recess. So you removed your intercostal muscles down to that line of pleural reflection. And now we're going to remove the ribs. So in the calf, you can actually remove all of the ribs except for the last couple. We're just going to leave those in place. And we'll take out all of these ribs. So you're going to cut with a striker saw or pruners, and you're going to cut dorsally right underneath your longissimus system here. So cut dorsally, and then you'll cut again ventrally near the costochondral junction here along that line of pleural reflection. So you'll cut all of them dorsally and ventrally and just remove them, and you can discard them. So we'll do that. I'll show you a demo of how to do a couple of these ribs, and then you can go ahead and continue and finish taking out the ribs on both the left and right sides. So here you can see we've completed the removal of all of the ribs on the left side of the calf here. And then you're also completing that on the right side as well. So for the thorax dissection, we're going to look at the lung, and then we're going to remove the lung on each side and then dissect inside the chest cavity. So here on the left side, you can see the left lung, and your left lung in the calf will have a cranial lobe. So the cranial lobe is here, and the caudal lobe is here. But one difference to note in the calf is that the cranial lobe has a cranial part. So this is the cranial part, and a caudal part. So that's a difference from the pony. So in the calf, the cranial lobe on the left side has a cranial part and a caudal part. And then we have the caudal lobe here. So you're going to look at a few structures, or try to look at a few structures by reflecting the lung and then removing it. But I'm going to, for demo purposes, remove the lung so that we can continue and just look at everything we can see from the left side. So we'll move in a little closer and take a look at that and take out the left lung. So the left lung, you'll want to kind of pull it out and see some of the structures before you take out the lung, because you're going to be cutting through the hilus. So the hilus is everything entering the lung here, but you want to make sure you're not cutting nerves and other important structures as you do that. So you remove the lung as one whole piece, and then on the calves, of course, we don't have the injection to help us distinguish things. So the bronchi, you have a principal bronchi on the left side that will then go to lobar bronchi, and the bronchi have cartilage in their walls, so those will be easier to identify. Then you'll have pulmonary arteries and pulmonary veins. So pulmonary artery should have a thicker wall. So this one looks like it's going to be a pulmonary artery right here. And then pulmonary veins should have thinner walls. So that might be a pulmonary vein here. So then we'll look at the inside of the chest cavity and start naming some of those structures. So here inside the thorax, in the calf, you'll have a lot of thymus. And so like we saw cervical thymus in the neck, you also have thymus inside the chest cavity here, and it really does get in the way, and you have to work kind of through it to find things. So don't feel bad about tearing apart some of the thymus, because you just have to get to what you need to see. So here we'll start. We'll find the vagus nerve first. So the vagus nerve is this one right here. So that's going right by the base of the heart, so right by the lungs as well, because we cut out the lungs here. So you want to find that vagus nerve, and then you can try and find the left recurrent laryngeal nerve coming off of the vagus, but it can be pretty difficult to see. And so it's going to come off, I don't know if you can see it right there, coming off, and it's wrapping around the aortic arch. Then it will go back up the trachea on the left side. So the left recurrent laryngeal nerve coming off of the vagus nerve. Then our vagus nerve will continue caudally, and then it will branch into those dorsal and ventral branches. But before we do that, I just want to point out that the phrenic nerve here is right next to that vagus nerve. So you have phrenic nerve, then you have vagus nerve right here. And then as long as we're pointing out nerves, I'll point out the sympathetic trunk. So sympathetic trunk is that one along the spine here. So sympathetic trunk up here, then you have vagus nerve and phrenic nerve. So then we'll take a look and follow our vagus nerve caudally. So the vagus nerve, you'll see, runs underneath this vessel, which is going to get in your way as well. So in the calf, you have a left azygos vein as well as a right azygos vein in most specimens. So the left azygos vein is here, and it runs up here along the spine, right there. So that will kind of get in your way, so you'll have to work around that. But then if you trace the vagus nerve, I'm going to try and pull it out here so you can see the branches. There we go. So the vagus nerve on the left side here is branching into a dorsal branch and a ventral branch. So that will happen on the right side as well. You'll have a dorsal and ventral branch. So here you have the ventral branch on the left, and it's actually connecting right here with the ventral branch on the right. And so then from that point on, you have a ventral vagal trunk. So that will run along the ventral aspect of the esophagus here. So ventral vagal trunk, esophagus is this big guy right here. Then we have dorsal branch from the left right here. And that will come together further distally and will come together with your right dorsal branch as well. So here in the calf you have a lot of fat to work around, just to give you fair warning. Here you have the dorsal branch from the right side, dorsal branch from the left side, and that will continue then after that point as the dorsal vagal trunk right here. So that brings us to this huge lymph node that you see here. So all of this is caudal mediastinal lymph node, or lymph nodes because there's a couple of them, but caudal mediastinal in the calf is very, very large. So we'll have that, and you can also look for the tracheobronchial lymph nodes, but sometimes they're a little hard to see. It looks like we have one here that we had to kind of work around here for the nerve. So tracheobronchial lymph node there, and the tracheobronchial lymph nodes combined with the caudal mediastinal lymph nodes create tracheobronchial lymphocenter. All right, so we'll continue on and look at the diaphragm for just a moment. So we have the diaphragm here, obviously, and the tendinous center is kind of the same as it was in the pony. It's that kind of see-through part here. And we have the esophageal hiatus, so you have esophagus here, and the hole through the diaphragm that the esophagus runs through is the esophageal hiatus. Here from this side you can see the caudal vena cava right here. And so the caudal vena cava, after you remove the right lung, you'll see it better because you have to move the accessory lobe on the right lung to see it. But caudal vena cava runs through the caval foramen in the diaphragm there. And here on the esophageal hiatus on either side, you have a crura, so that's that muscular part that we saw. So we'll take a look closer at that a little bit later. And then your aorta here is running down and will go through the aortic hiatus, which is way down inside. So we'll look at the heart next. You have the pericardial sac. I've removed a lot of mine, so I can't, oh, there's some there. So you'll have to cut through that and then reflect that and get the heart out of the pericardial sac to see the structures. And again, on the heart, for the calf, we don't have injection, so it'll be a little more difficult to dissect. And you also have to be careful because you will tend to have a lot of fluid in the chest, so just be aware of that and be careful. So here on the heart, we are looking at the left side, but we can see the right ventricle right here as I pull it out and have the pulmonary trunk coming out of that. So pulmonary trunk is here, the left auricle you can see here, and then the left atrium and left ventricle. So here I want to show you the left coronary artery coming out. So the left coronary artery maybe is a little bit easier to see on this one, but there's a lot of fat that you have to dig through to find it. So the left coronary artery is here, coming off of the aorta, and it gives off a periconal branch and then a circumflex branch. The circumflex branch will kind of run under your left auricle in that coronary groove, and it also runs alongside the great cardiac vein, which is, again, there's no injection, so it's very difficult to see, but it's running right underneath your auricle. And so the great cardiac vein is running here. It's not full, so you can't see it very well, but just so you know where to look for it. So the great cardiac vein would be there. And then when we get to the right side, I'll point out a difference in the heart that's different for the calf. But for right now, we'll just continue here on the left side. So another thing I want to point out, so we already saw that right azygos vein. So we'll just move that out of the way. And you have your pulmonary trunk right here. You have your aorta here. So this is the aortic arch. And then we have that ligamentum arteriosum. So that connection between your pulmonary trunk and your aorta. So pulmonary trunk and aorta, ligamentum arteriosum right in between there. All right, so then we'll go back to the aorta. And so we have the aortic arch here, and we have the brachiocephalic trunk coming off of that aortic arch. So again, you have to work through this thymus tissue. So thymic tissue is kind of everywhere in the calf. But here we have brachiocephalic trunk and that will continue cranially and give off a left subclavian artery and a right subclavian artery. So here you can see a left subclavian artery coming off of that brachiocephalic trunk. And then off of your left subclavian artery, we have some branches to name. So here, if I can maybe hold this out a little. They're a little bit harder to see. And so you have, your internal thoracic will be going inside the chest here. You'll have your vertebral artery going up towards the back here. So vertebral. And you have a superficial cervical artery here. And on your vertebral, it actually looks like we have our costocervical possibly coming off there rather than as a separate branch. So vertebral, but you have this common trunk. So common trunk, and then you have a costocervical artery that would go here and would have gone to the ribs. And then we have the vertebral, which I'll try and kind of pull out here. So vertebral is going deeper up towards the back there. So vertebral, costocervical, internal thoracic, the one going down inside the chest, and then the continuation here is axillary. So that's what's going out into the forelimb, axillary artery. And we had that superficial cervical little guy right here. And then you can also see in this region where your external jugular is coming into the chest here. So you have external jugular obviously was out in the neck, and then it comes inside and then connects with your subclavian. External jugular vein comes in there and connects with the subclavian vein here. So here we're just taking a closer look at the diaphragm, and we have the esophagus here that's going through the esophageal hiatus. Then we have the crura, so you have a left crus here, that's the muscular part, and you'll have a right crus on the other side. And then we have the aorta here, and that goes through the aortic hiatus. So I'm just going to be able to put the probe in there, so hopefully you can see where that probe is going. It's really far in there, so hopefully you can see a little bit. But that's the aortic hiatus, where the aorta travels through the diaphragm. And now we'll go ahead and take a look at the right side of the calf. So here on the right side, I've taken out all of my ribs, and I'm holding on to my lung because I've removed it already, and it will fall out. So we'll just talk about the lung quickly, and then we'll move on. So on the right side in the calf, the lung will have the cranial lobe here, and that will be divided into a cranial part and a caudal part. Then you'll have the middle lobe here, and you'll have a caudal lobe and then an accessory lobe. So I'm just going to go ahead and pull this out so I can show you the accessory. So here, this little guy is the accessory lobe. So you have to be careful on the right lung on the calf because it kind of will come out in pieces if you're not really careful. And so the accessory lobe may fall off, so that's this little guy. And your cranial lobe also has a tendency to fall off as well. And so on the cranial lobe, you have a special structure to note on the calf, and that's called the tracheal bronchus. Tracheal bronchus. So the tracheal bronchus here is considered a primary bronchus, and it's actually on the calf, it's right here. So here on the calf is the tracheal bronchus, where you have the trachea here, and the regular right side primary bronchus would be here. So that tracheal bronchus is something special that you need to note in the calf. Otherwise, all of the same structures can be found on the right side. So I'm just going to put that lung down, and then we'll talk about things on the right side in the thorax. So here on the right side, you'll again want to find your vagus nerve. So the vagus nerve is here. And you can try and look for a right recurrent laryngeal, but it's going to be fairly far forward. So you may not want to attempt that, but you can if you want to. So I did not do that on this one. The right recurrent laryngeal was too far forward for me to find, so too far cranially. Here, vagus, we're going to follow that, and we're going to look at these lymph nodes. So we have the tracheobronchial lymph nodes. So here would be one here. And then we have the caudal mediastinal lymph nodes, which are these really big guys here we saw from the other side. And those together create the tracheobronchial lymphocenter. So those together. Now the vagus nerve will do the same thing as it did on the left side, here on the right side. So vagus nerve here on the right will split into a dorsal branch and a ventral branch. So here we'll hold up the two. So ventral branch, dorsal branch on the right side will then go together with the left side. So here you have the ventral branch coming together with the ventral branch. Move that out of the way so hopefully you can see. Ventral branch here on the right side coming together with the ventral branch from the left side then creates a ventral vagal trunk that you can see running along the ventral aspect of the esophagus here. So ventral vagal trunk, esophagus is here. Then we have those dorsal branches from both left and right vagus coming together right here. And so you have the dorsal branch on the right, dorsal branch on the left, coming together, creating a dorsal vagal trunk. Then here, where the esophagus goes through the diaphragm, is the esophageal hiatus. You can also see the right crus right here of the diaphragm, that muscular portion. And here we have the caval foramen. So the caudal vena cava is here, and that goes through the caval foramen. So that's the hole in the diaphragm. You have the central tendon of the diaphragm you can see also on this side. So caval foramen, esophageal hiatus. And then we have some nerves to look at. So we already looked at the vagus nerve, which was here. And so we have the phrenic nerve here going to the diaphragm. And we also have the sympathetic trunk. So sympathetic trunk running here along the spine. And also when we get to this point, we can see right here you have another azygos. So you have a right azygos vein in the calf as well as a left most of the time. So right azygos vein here, and it kind of goes along with that sympathetic trunk. So we'll take a look here and look at some of these heart structures as well. So here we have the trachea right here, and you had that right principal bronchus, and I showed you the tracheal bronchus, which is right here, going to that cranial lobe on the right lung. Then here we have the caudal vena cava, we have cranial vena cava. So we have the right atrium here and right auricle here. We're seeing the right ventricle right here. And one of the things I mentioned that I would point out that's different in the calf, so hopefully I can try and kind of pull this out of the pericardial sac a little bit. And right here, so this is from the other side, this is from the left side. This is that circumflex branch coming from the left, and that actually ends for the calf as the subsinuosal artery right here. So the subsinuosal branch comes down, but it's coming from the left coronary artery, so coming off the circumflex branch, rather than coming from the right. So that's a difference. The pony has the subsinuosal coming off of the right coronary artery, and the calf has it coming off of the left coronary artery. So here, in this fat in the coronary groove, you've got your right coronary artery. So coming out from underneath, coming off the aorta, and it's coming around, so this is right coronary artery in the calf here. So then we also have the branches off of the subclavian to take a look at on this side. So if you move cranially, this is a little bit harder to see on this side, at least I think so. And so I'll do the best I can to show you. But, so you had that brachiocephalic trunk that gives off the right and left subclavian arteries. So here on the right side, we're seeing the right subclavian artery, which is very short and thick, so it's just this part where the probe is kind of elevating. And then you have all those branches coming off. So the branches would be, you have the internal thoracic is usually the easiest one to find because it goes right down inside the chest. Then here I have a vertebral, but again, we have, just like on the other side we saw, the costocervical, but this one's a little more intact so we can see where it's going. Costocervical is coming off of this little common trunk, and then our vertebral actually keeps going. So it dives deeper up towards the neck here. So vertebral there, costocervical here, and then we have our superficial cervical, is just this little guy here. And then this would continue and become axillary. So after it's outside of the rib cage, it becomes axillary and goes out to the right forelimb. From this view, you can't see much of your external jugular, but we did see them in the neck. So external jugular would be kind of coming through here, and then it would connect with the subclavian vein as well. So external jugular vein would be there. And then the last couple structures we need to look at are the termination of the aorta. So you have the subclavians come off, and then it becomes the bicarotid trunk, and then gives off your left and right common carotids. So we'll take a look at that, and then also we need to look at the internal jugular veins for the calf. So we're looking at the ventral midline of the neck in the calf here, and on mine you can see it's kind of torn apart, but you have all of this cervical thymus that's going to be in your way. So you have to work around that to get at this view for the bicarotid trunk. So you're kind of separating your sternal muscles and moving this cervical thymus out of the way. And then deep down in here, hopefully you can see where you have, so you see the two splitting off, and those are the common carotids, and they're coming from the bicarotid trunk. So the bicarotid trunk is where those are combined. So that's right here, way down deep underneath the trachea here. So bicarotid trunk, and then we have the left common carotid artery here, and then you have your right common carotid artery going to the right side. Then also right alongside your carotids in the carotid sheath, along with your vagosympathetic trunk, you will also have an internal jugular vein. So it won't be very big, and it's not injected, so it's hard to see. But here right alongside, so my carotid is right here, and in this carotid sheath, all this fascia, you should have a little internal jugular vein. So you should have those on either side, both left and right, in the calf.